Omicron is WHO's fifth variant of concern. Experts urge patience.
The Omicron variant of SARS-CoV-2 was recently identified by scientists in South Africa. On Tuesday, November 23, scientists in South Africa alerted the world to a new variant of SARS-CoV-2, the virus that causes COVID-19. It's too soon to tell whether Omicron will continue to spread internationally, or if it will overtake Delta as the primary variant of concern, the Wall Street Journal notes. Still, the WHO designated Omicron as its fifth variant of concern on November 26. Little is known about the new variant, but experts have been working to glean insights from its long list of mutations, as well as the preliminary clinical reports from South Africa. Virologist Pei-Yong Shi of the University of Texas Medical Branch in Galveston tells NPR that the rapid spread to several South African provinces is concerning, as it may indicate the variant is outcompeting Delta. But University of Massachusetts Medical School virologist Jeremy Lubin stresses that it's too early to tell. Everyone is afraid that Omicron will be significantly more transmissible than Delta. Scripps Research infectious disease researcher Christian Anderson tells Science that the sudden increase in Omicron infections could be largely driven by super-spreading events, such as university or sports events, rather than increased transmissibility. The Omicron variant diverges from the original SARS-CoV-2 virus by about 50 mutations, including more than 24 in the spike protein, Nature reports, far more than any other variant of SARS-CoV-2. Alex Sigel, a virologist at the University of KwaZulu-Natal, tells the Wall Street Journal that it's likely that the variant accumulated so many changes by surviving in a single patient for months, where it could slowly morph from a variant known as B.11, which by now has nearly vanished from the world, into Omicron. Its detection in South Africa could be because of the country's robust genomic surveillance program rather than proximity to the variant's emergence, says STAT. However, it will take time, perhaps weeks, for experts to sort out whether or to what extent that's the case, according to the WHO update. Pharmaceutical companies say they're monitoring the situation to see if modifications to their vaccines need to be made. However, fully understanding how these and the variant's other mutations may alter the dynamics of Omicron infections will require researchers to gather and analyze a lot more data over the coming days and weeks. We have been through all of this before with the Alpha and Delta variant. University of Leicester clinical virologist Julian Tang tells Science Focus, but the main difference is that the scientific evidence for the effectiveness of masks and social distancing has increased, and there is more conviction now amongst scientists that these measures do work to reduce the spread of the virus.